Irregular periods, acne, obesity, and infertility. What is common between all of them is that they are part of a disease spectrum that affects 1 in every 5 women across the globe, and especially more prevalent in the middle, upper middle, and the affluent classes of the society. I'm talking about polycystic ovarian disease. Hi, I'm Dr. Soumya Tripathi, and today we'll talk about PCOS or PCOD. Let's start with the causes and the symptoms. In PCOS, several small cysts develop in the ovary that make it bulky and increase the hormone production, especially the male hormones, and cause an imbalance between the estrogen and the progesterone levels in the body. Here are a few symptoms of PCOS that you should look out for, and if they persist, you should get a checkup for PCOS done at the earliest. If your periods are not regular, then anticipating the next period can be very stressful. If you have any of the following symptoms, such as scanty periods, delayed or early periods, heavy flow during periods, or heavy flow after a prolonged time of no periods, or even no periods at all, then it may be because of irregular ovulation or release of the egg from the ovary. Irregular periods is one of the most common symptoms of PCOS. If you have excessive hair growth on your face, chin, upper lips, chest, back, or thighs, then it can be a serious concern, especially for young girls. This condition is called hirsutism and is because of excessive male hormones or androgens. If you are having hair loss in the scalp or the temple area, then that is called male pattern baldness, and it is because of excess androgen levels in the body, which is common in PCOS. Excess androgens in the body also leads to oily skin, which can result in acne. If you have acne that does not go away even with regular medication, then it may be possible because of PCOS. If you are planning pregnancy but are unable to conceive even after 1 year of unprotected intercourse, then it may be because of irregular or absent ovulation, which is a feature of PCOS. However, it is a myth that you cannot conceive with PCOS. These days, advanced options are available that treat infertility in PCOS, and you can contact your gynecologist for the same. If you have PCOS, then it is very easy to gather fat, especially around the lower abdomen and the hips area. This condition is called truncal obesity. This is especially common in insulin resistance and is also related to increased androgen levels in PCOS. The vicious cycle of insulin resistance and obesity can cause a number of complications in the long run, such as diabetes mellitus, hypertension, and cardiovascular disease. This is also known as Metabolic Syndrome. Hence, you should get checked for PCOS at the earliest. If you notice dark velvety patches behind the neck area, in the armpits, or under the breast, or in the inner aspect of the thigh, then this condition is called Acanthosis nigricans, and it's because of insulin resistance that develops in PCOS. This condition does not go away with creams, with haldi or besan or even retinoids. And you should seek treatment for PCOS to treat this condition. Problems such as poor sleep, anxiety, and mood swings are also because of the hormonal imbalance that this condition brings with itself. So, what are the other symptoms that you think are commonly confused with PCOS? Write down in the comment section and I'll reply to them based on this current scientific evidence. Now that we know the symptoms of PCOS, let us find out why it develops in the first place so that we can make the necessary lifestyle changes in order to reduce its incidence. PCOS does have a genetic component. So if your mother or your sister suffer from PCOS, then it's quite likely that you are at a risk. So you should look out for the symptoms that I've mentioned and must get a checkup done at the earliest. Sedentary lifestyle and bad food choices both are linked to obesity. Irregular sleep cycle is linked to developing chronic stress, and both ultimately may lead to PCOS. This stresses the importance of leading a healthy lifestyle. Certain genetic changes bring about insulin resistance in the body that also negatively affect the ovaries. Insulin resistance is one of the major causes of PCOS. It's also related to developing obesity, and in 50% of these patients, diabetes mellitus develops in the long run. As per several scientific studies, exposure to chemicals that we come across in our daily lives, such as bisphenol A, which is found in plastic bottle, exposure to talc, room fresheners, or exposure to pesticides, also lead to hormonal imbalance in the body. This leads to the development of PCOS. If you are leading a stressful life because of your studies or your job or for any other reason, then it increases the stress hormone levels and the androgen levels in your body, and it can also lead to the development of PCOS. Now that we have covered in detail the causes and the symptoms of PCOS, does having small cysts in the ovary always mean PCOS? Not really. If you went for a routine ultrasound and in the report it's written polycystic ovaries, then you may or even may not have PCOS. As per the Rotterdam's criteria, having 2 of the 3 symptoms results in PCOS. Irregular periods, high level of androgens, and small cysts in the ovaries arranged in a string of pearl fashion. So if you have polycystic ovaries without features of irregular periods or high androgens, then PCOS may be unlikely. In this video, we discussed about the causes and the symptoms of PCOS. In the next video, we will discuss when to visit a doctor and what are the treatment options available for PCOS. Do tell me if you have liked this video and comment, share and subscribe.